I can do something about this. Like, I have a say in whether or not I'm going to continue in this process, if I'm going to answer OCD's questions, if I'm going to do compulsions, if I'm going to stay in the OCD bubble or not. I might not be able to control or have a say in how my body responds and the emotions that come up in response, but like, I do have a say in whether or not I want to continue down the same cycle.
Welcome to OCD Whisperer Podcast. Today with me, I have Gina Abbondante. And if you can please tell us a little bit about yourself.
Sure. So I am a licensed clinical social worker here in New Jersey, and I specialize in the treatment of OCD and anxiety disorders during pregnancy and postpartum.
So the reason I wanted to have you on the show is I wanted to talk about motherhood, pregnancy, OCD, and how do you use inference-based CBT with this? It sounds like there's a lot going on during this process. So I guess my first question to you is, just more generally, how would you apply inference-based CBT when a mother is expecting or even, perhaps just had a child? So what would be how do you separate that out from what I would assume, hormonal changes, natural worries, and so on?
Yeah. So I don't really have to augment a CBT treatment really all that much differently. The one thing that I do really keep an eye on for my clients that are either pregnant or postpartum is I'm really looking at sleep. So I want to make sure that they are getting adequate sleep, because if someone is not sleeping, regardless of pregnant or postpartum or not, it's just going to throw gasoline on anxiety and OCD. So it's just going to make it so much worse. But when it comes to treatment, I don't really have to augment it or change it in any way. I'm going to use the same, approach that I would use for anyone that's either not pregnant or hasn't just had a baby. But yeah, I think ICBT can be so much more of a gentle approach for folks that are already feeling like they're totally overwhelmed. There's a new baby in the house, whether it's their first, second, third, fourth, whatever. And they're just feeling like they are just maxed out and don't feel like they can do exposures, or just don't feel like they're in a place that they can do that. That it's a really good approach for them.
And so how would somebody apply it though? So if we get into a specific example, maybe you can share that with us. I think that would be a better way to try to conceptualize this or actually hear what that would really look like.
Yeah. So let's say I have someone who's coming to me and they are afraid that they're going to harm their child. And it's a pretty typical one that we see in postpartum. So I would start at the very beginning, and I would look at someone's doubt sequence. I'm going to look at how their doubt is being formed. I'm going to help them to identify that story that OCD is creating in their imagination. We're going to break that down. I'm going to help them to be able to see their role of imagination and the role of their feared possible self and the creation of how they got to that content. That's a big question. I hear frequently, how did I land with this content? How did I get stuck with this one? This one bothers me so much. So really working quite a bit on that feared possible self and seeing how they kind of landed in this particular content versus any of the plethora of other OCD contents that are out there. So yeah, I would start with at ground zero, starting with the very beginning, and really working through each of those steps and each of those the modules through a CBT treatment, and helping them to kind of just deconstruct their OCD and really being able to see us behind the machine, so to speak, and give them tools to be able to step away and disengage from that whole process.
So as you're talking about this, something that I know often comes to mind is, when we're using ERP, this concept of uncertainty and this conversation that we usually have about, well, don't we embrace and retain uncertainty all the time? Aren't we always living with uncertainty? Aren't we always facing uncertainty? Well, how would that then be different, or how does that get addressed in this situation?
Yeah, for sure. I mean, whether you have OCD or not, we face uncertainty every single day. I mean, we can look at just very mundane examples of, I don't know, if I go out to get in my car if my car is going to start. I don't know if you're looking from a postpartum example. I don't know if a baby's going to sleep through the night, if you're going to be able to sleep. We are facing uncertainty every single day. However, when it comes to OCD, because there's specificity in someone's obsessional content, even though a lot of people will come and say, well, my topic jumps, right? My content jumps all over the place. But if we look a little bit deeper, a little bit further into that, generally there is a specificity. You're not afraid of all harm coming to your child. It's one specific form of harm, or that you are going to be the harmful person, or you're not afraid of all germs. You're afraid of one specific germ or one specific illness that your child is going to get. So it's not that people with OCD are intolerant of uncertainty. They're intolerant of the uncertainty that their doubts are giving them. And I think that's a really important piece because just like the rest of us, folks with OCD deal with uncertainty just fine in all other areas of their life when OCD is not triggered. So it's just this very narrow band of uncertainty that people tend to be like, oh my gosh, I can't tolerate this. And that's where it's not really about tolerating the uncertainty. It's about being able to really break that down and see that we don't have to have uncertainty in this very moment, right? We cannot answer the question of, will my child ever get harmed? I don't know. Probably, because they're kids, right? And this is what it just happens, right? But in this very moment, we don't have to rely on uncertainty or be afraid of uncertainty, because we have all of the information that we need in this very moment to help from our imagination.
Okay, so then if we're saying that, then how is that different from living in, I guess, just the present moment? I mean, don't we generally worry about, things that could happen? So how does that differ then, I guess, than, just a standard way of living for anybody without OCD, where, we all might wonder something, we might not know something for sure, but generally, even after a little bit of worry or concern or mulling something in your mind, typically we would, I guess, drop it, or maybe if there's something to come up with, we'd come up with that if it needs some solution, and we move on. So in this situation, what is it that we're really teasing apart here to understand? Because I think there's still confusion around, well, if we're saying, well, we do live with uncertainty, there are things we really don't know, right? And there are questions we might ask ourselves that really we don't have an answer for, or we might not really get an answer for until we're in the moment, facing a situation. So,
right.
I guess then how does that differ from that ERP lens? Because that's one of the conversations there versus the ICBT lens.
Yeah. Well, ERP would have somebody lean into the uncertainty in that moment, right? In terms of an OCD doubt. So again, just bringing up the OCD doubt of, oh my gosh, what if I harm my children, right? So from an ERP lens, it would be coming from, well, I don't know, maybe not. We have to lean into the uncertainty that we just don't know. You don't know if you're going to harm your child or not. An ICBT lens, we aren't asking people to lean into that uncertainty. We're leaning into having them use their reality sensing and what they know to be true about themselves to say, in this moment, I don't have to say maybe not, because in this moment, I know who I am. I know what my intentions are. I know what my common sense tells me about who I am. I know what my inner sense data, my values, my intentions, all of these things. I know what these things are saying to me. So I don't have to lean into that maybe not. I can lean into who I am, and drop the answering of OCD's questions in this moment. So we're not solving it from like a greater point, right? Like, will I ever harm my child? Don't know. In this moment, in this exact moment, we can lean into using our senses and what we know about ourselves to be able to unhook from that OCD process.
Got it. So it sounds like what we're really doing is helping people restore that sense of self and really conclude things from that perspective instead of, well, I could be this person one day. It's like, well, sure, we could theoretically say any of that is possible, but it doesn't make any of that any more relevant than, saying, well, right now we could possibly be, hit with a meteorite while we're having this conversation. Right? We really want to then slow down and look at what's actually relevant based on what I know now, what you just said, which is, who am I actually really? How do I operate? What are my intentions? And that I know, I have no desire to hurt my baby. So why would I go into that kind of story, I suppose, right? Why would I wonder about what if I could, what if I might? That we want to essentially treat that as irrelevant line of questioning that there's no basis really for that.
Right. And inevitably, I have someone that says, okay, well, right now I know who I am. But what if in the future something happens, right? And that's just OCD's way of rounding back on us and using a trick to pull us back into that OCD bubble. And that's the maybe later trick. Okay, well, I know who I am right now, but what if in 5 minutes, 5 weeks, 5 years, whatever, something happens and it could be harmful, then I have to prevent that I have to figure out what I can do to prevent it from happening then. But it's important to be able to see that is a trick, right? Well, I don't know. I don't know who I'm going to be in the future, right? But in this moment, we always have to come back to this particular moment. I know who I am. I know my intentions. I know my values, what's important to me. Now I know that I have to unhook from answering those questions and not get pulled back in with those OCD tricks back into my imagination.
So I know one thing I've heard about from ICBT lens is this concept of functional certainty, this state of knowing, right? And so in what we're talking about today, because we are kind of going a little bit between, well, uncertainty, sure, we all don't always know answers to things. But how does that concept fit into, because, we're talking about ICBT is used to quote unquote resolve OCD, resolve obsessional doubt, right? This word resolution is a big one because it definitely comes up for people all the time in terms of, well, is this something that can help me then not have OCD? Is this something that will help me completely stop it dead in its tracks? What would you say to that?
No. I would say no.
As someone who has OCD and uses ICBT for myself in my own treatment, I think saying resolving OCD leads people to believe that you're resolving it forever. And the truth is, it's not true. You're resolving it in this moment, right? Sure, for some people, they might be able to use ICBT and it resolves it forever. And they don't have to keep coming back to it. I would say those are the outliers. I would say that most people, when they are faced with a trigger and their OCD wakes up and is loud and it's like, oh, you called me, you've said my name, I'm here. You have to use the ICBT skills every time the trigger occurs. And it's not about, and from my perspective, it's not about resolving OCD for the rest of your life. It's about resolving it in that moment and being able to put the obsession down, put the doubts down, and disengage. You're resolving your need to keep answering OCD's questions and getting embroiled in the process. So you're learning how to identify what's OCD and what is a reasonable doubt, and learning how to unhook from that and resolving it in that moment, not resolving and curing your OCD as a whole, if that makes sense.
Yeah. So, when you're saying that, part of what comes up from what I understood is that, I think one of the questions becomes also, well, why is this even a hook in the first place, right? What is it that what's happening or what's happened to me or what's my internal kind of story about myself that makes me vulnerable to whatever that topic is, right? And ICBT, doesn't it aim to work and address kind of our sense of self and understanding who we actually are versus this self-identity we've developed that really we would say, well, I say it's an OCD identity. It's not truly based on kind of the reality of who you really are at your core. It can be based on things that maybe have happened, in fact, or things you've experienced or things you've heard. So it can stem from real life moments, but often is very misconstrued, very out of context, very kind of misinformed, if you will, but feels very, very highly believable. What would you say with that? Would that not be a place to be able to understand where and how this construct of our sense of self even got developed, and how does that influence kind of our viewpoint, like, glasses that we're wearing through which we're seeing things?
Yeah. Yeah. I mean, I think everybody, whether or not someone has OCD or not, everybody has a vulnerable self, right? We have parts of ourselves that we don't feel that great about, or we have shaky self-confidence in certain areas. And we all have that. But I think when someone has OCD, it takes those vulnerabilities and it pulls them in and creates this bigger story, this more scary story of like, these are things that you don't feel so like solid about. That must mean something about you, right? So it's like, okay, I'm not great with insert whatever here, right? I'm not great with public speaking, just pulling that state there. I'm not great with public speaking. Okay, well, OCD might pull that in and be like, well, because you don't feel so confident about doing that, that must mean something really bad about you. OCD likes to take these sort of general things that we struggle with and like turn the flashlight back onto who we are. Like, what does that mean about who we are as people? Um, so yeah, I mean, definitely using ICBT, we can maybe shine a light on some of those vulnerabilities that we had, but we kind of functioned with it, and how it's taking those things and pulling it in an out of context way and making a whole lot of meaning about it through that really convincing, scary story, and turning it into that feared possible self even more.
Got it. So then for somebody, who's a new parent and mother, and
Mhm.
of course, it sounds like there's going to be natural kind of questions, especially if it's your first kid. I would assume, second, third kid, you kind of had your first experience. You have a better sense of understanding what's happening, or kind of what to expect, right? So how would you say that this all plays out in that role in terms of how somebody might misinterpret this experience that they're now in of, motherhood, and of course the physiological literal changes that are happening in their body, hormonal changes,
Yeah.
plus of course now your schedule is going to be completely, upside down, and all of it. Yeah. What would you say about that, and how does somebody with that experience essentially start to misconstrue that,
Mhm.
instead of seeing that for what it is, like the facts what I just kind of mentioned, and instead does something else with it?
Yeah. So having a child, whether it's first baby, second baby, third, fourth, whatever, it's always a time when your identity changes. And I think a lot of people feel mostly aware that like, oh yeah, my life is going to change. My identity is going to change. These things are going to change when the first baby comes along. But I don't think a lot of people are totally like, you don't get it until you're in it. And it's like, oh wow, it really is. This is totally not what I was expecting. Um, and even more so, I think it happens from first baby to second and second to third. Like, again, it's that like, oh, I've done this already. It's going to be the same. No, your identity changes after each baby, right? And I think that is just total breeding ground for OCD to try to sneak in there and latch on. Again, depending on what someone's content is, I think having a child is a feeling of uh, over responsibility as well. Like we're so responsible for this little person that can't do anything for themselves. They're totally helpless and dependent upon us. So that over responsibility can sneak in. The fear of something bad happening to them. We don't want something to happen to our child. Um, so that fear, just a sort of general fear of like, oh, what if something happens? Like I'd have to try to prevent these things from happening, and then OCD kind of pull in there and pull the our inability to cope, or feelings like we can't cope if something bad happens. It can play on that as well. But I think there's a lot of different areas in terms of perinatal and postpartum experience where OCD can really kind of like weasel its way in. And yeah, hormonal changes that absolutely can wreak havoc with someone's emotions, and OCD likes to play on that. Lack of sleep, but non-birthing partners and spouses can also experience postpartum and perinatal OCD. So hormones don't play the full picture, although obviously non-birthing partners will experience hormone shifts as well. It's just not the same that someone like a birthing woman would experience. But non-birthing partners and spouses can experience perinatal and postpartum OCD as well. So again, it just sort of speaks to that like identity shift, responsibility or over responsibility shift. And there's so many of these little areas that OCD can just kind of like weasel its way right in there.
Yeah. Can you actually tell me a little bit more about the non-birthing partners and kind of what you've seen or noticed in terms of what are some of those shifts that they might experience and kind of where might OCD latch onto that or kind of grab it out of its context and start to create a whole other narrative and story?
Yeah. So I don't see too many differing areas of content as like, so if we have um, women that are experiencing postpartum depression or postpartum OCD or perinatal OCD and non-birthing partners and spouses, like across the board, the areas of content are pretty much the same, right? So we see a lot of harm, we see contamination, we see fear of the baby dying, we see um, fear of psychosis or mental health obsessions that come up. So we see sort of the same areas of content, which I think is really pretty interesting. So it's the same sort of dynamic, right? It's the same shift in hyper responsibility or over responsibility, identity shifts as well. For some extent, women, their identity starts to shift when they're pregnant already. So there's like a little bit of like a gentler, more gradually, like 10 months to kind of like acclimate to that. Whereas non-birthing partners and spouses, they don't always get that. It's just they're kind of humming along, doing their thing, and like, boom, here's baby. Now your identity changes overnight. Um, so it's the same kind of things that are occurring for them, and still going to play on those vulnerable self-themes and pull those things in, um, and the same sort of risk factors that would be there for women that are delivering this one.
So then I guess for a final thought, if you will, what is with all the experience you have with working with this particular population and using sounds like ICBT and from what I'm gathering, it sounds like it's not just ICBT. There's other things that you're really bringing in because it's such a kind of wealth of an experience and transition. But I guess what would you say for anybody that's listening today, what would be something that they can look forward to that in terms of how ICBT can really help them if they're having this kind of an experience?
I think one of the biggest things that people report to me is a return of their autonomy. So feeling like, OCD is an absolute beast, and it just takes away so much from people's lives. And one of the most common things I hear is like, I have a say in this. OCD I'm not afraid that it's just going to happen, right? I'm just going to be triggered and then I can't deal with it. I don't know what to do. It's that sense of like, oh, I can do something about this. Like I have a say in whether or not I'm going to continue in this process, if I'm going to answer OCD's questions, if I'm going to do compulsions, if I'm going to stay in the OCD bubble or not. I have a say in what happens here, right? I might not be able to control or have a say in how my body responds and the emotions that come up in response, but like I do have a say in whether or not I want to continue down the same cycle. So I would say that's probably one of the biggest things because in the perinatal population and the postpartum population, there's so many things that happen to your body that you don't have any control over, right? And that is really hard and it is really scary. And I think that sense of like, this is so out of my control. And now I feel out of control and I'm just grasping at anything to like feel like I can have some semblance of like say in what happens here. I think that's a really big thing for a lot of folks to feel like, oh, wait, I have some tools to be able to decide how this looks. Where you don't necessarily get to have any say over what your pregnancy looks like, what your delivery looks like, what your body looks like postpartum, like how your body functions postpartum, any of these things. You don't really get too much of a say in that, but you do get to have a say in what your recovery looks like from OCD.
I love that. That's really, I think, poignant and beautiful in terms of like, yeah, this is an experience you're having that you really can't, like, there's nothing but be in the experience, but then there's this other part of what you do around that experience. So thank you so much for sharing that. And so for anybody listening today, if they would like to find you, how can they find you?
Yeah, so you can find me and my practice at changeofmindcounseling.com. Um, and we also have OCD Training School where I've done quite a few courses on perinatal OCD as well as perinatal OCD versus postpartum psychosis. And I have some things in the works to maybe, put some self-help stuff in there one day because I hear lots of people asking for that. But yeah, you can find me in either of those places.
Wonderful. Thank you so much for coming on the show.
Yeah, you're welcome. Thanks for having me.